Good morning, ladies and gentlemen. We are about to begin our event. Please prepare yourself and sit. Morning. Welcome to the final presentation of Deakin Health Internship Program between Universitas Kristen Indonesia, International Internship, and Deakin University. I am Queen from International Office E, and I will be your Master of Ceremony for today's event. Before we begin, let us take a moment to express our gratitude to God for His blessing that allowed us to be here today. To officially start this event, I would like to invite Ms. Catherine to lead us in opening prayer. This week, let us pray in Christian. Father, thank you for keeping us in good health and bringing us to a new day and a weekend. We are here today for international internship and Deakin University for international and collaborations. Today, help us to stay attentive and follow our agendas for this. In this name, and I would like to extend a warm welcome and acknowledge the presence of our distinguished guests from International Internship. Here with us, Country Manager of International Internship, Tati. Also, Placement Coordinator of International Internship, Indami Masari. Finance Coordinator of International Internship, Celia. I would like to take this opportunity to also welcome and acknowledge the officials from Universitas Indonesia. Here with us, the Vice Dean of Faculty of Professional Studies, Mr. Arkan Kustuban Presuk, SKIMK. With us, the Head of Nursing Study Program, Nurse Arita Sitorus. Also here with us, the Head of Tax Management Study Program, Farun Nagar. Also the Director of International Office, Denisa Stella. Welcome to professional faculty of professional students. Next, we will listen to the speech coming from the Vice Rector for Student Affairs and Cooperation Office, Dr. Renzo Iet Federi Rosati Tebu SSXA, represented by the Director of International Office, Ms. Benedicta Stella Fortunae, SSXA. Ms. Bene, the time is yours. Yes, 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 yes. Yes. And hello people, can you hear me right? Okay, so I think there's trouble with the microphone. So good morning everyone. So I would like also to extend our congratulations to our Deakin Health Internship Program students that already completed your internship in our university. So today, actually, we're going to listen to their presentation regarding their internship program in our university. So welcome also to our international internship program, the country manager, Ibu Hidi, and also Ibu Linda, and also the rest of the team. I would like also to say hi to our leaders from UKI, specifically from vocational studies faculty. We have the Vice Dean Apprentice, also Pak Rudi as the head of tax management, and also our beloved Ibu Erita. So we also invite the students coming from a nursing study program in order to learn about our Deakin University students internship, and after that, hopefully, we can also collaborate this further with international internship, with many further programs in the future. So, on behalf of our Vice Rector for Student Affairs and Cooperation, Dr. Iyazid Tefu, we would like to say thanks to International Internship Program that already give us opportunity to extend our cooperation with Australian universities. This actually marked our third cooperation with Australian universities. The first one, I believe, it's
with Queensland University, and then Central Queensland University, and the third one is Deakin University. So thank you so much everyone for attending this program. Hopefully our program can also give you some insights, especially for our students here, and also for our four students. We would like also to say congratulations and also safe travels, because you are soon going to go back, right, to Australia. And if you have like any chance in the future to visit Indonesia, particularly Jakarta, don't forget to visit our university, because you are welcome always in our university. So yes, thank you so much everyone, and wish you a good luck presentation.
Thank you very much, Ms. Lene, for the opening speech. Next, we will hear also thank you speech and also program report from the country manager of International Internship, Bukeni. Bukeni, the time is yours.
Selamat pagi, assalamualaikum. Selamat pagi semuanya. Terima kasih banyak. Thank you so much for everyone who's attended this last day of our program participants from Deakin House. We are very thankful for the cooperation from Cookie, Verita, thank you so much. All the team of the vocational department, thank you so much. I hope you guys are learning something from this program, not only about the Opa, your research, but also about Indonesia's culture. I make friends with the Uki students here. Excited and very looking forward to see what you guys have been doing and come up with and your learnings during the program. So yes, reiterating what Bubene just said, this hopefully won't be the last time we're seeing you guys. Any opportunity in the future for you to come to Jakarta, please do let us know and keep in touch. I'd love to hear what you're going after this, what's coming and where you guys are in the future. So good luck and thank you so much. Terima kasih semuanya.
Thank you so much Bukeni, for the report. Next, we will hear of also the thank you speech coming from the supervisor of the Health Internship Program, the nurse Arita Sipolos. Please, the time is yours.
Terima kasih untuk kesempatannya. Good morning. How are you today? The traders as well as the students, I was texting you guys from International Internship. Lately and generally. Before I began my speech, open with pantun Indonesia, Pohon palem ada di simpang 3. Jangan lupa buahnya tolong dibawa. Meskipun kita berpisah raga, namun tetaplah bersatu. Thank you for the opportunity and the time given to me as a supervisor for the International Internship Program from November 19 to December 6 and 2024. And today I'm proud of Nabisani, Jasmine, Chanel, Tulani. Also, to the nursing student from the Faculty of Vocational Student of Deakin, Asia and Fernanda. Time has passed so fast. Today is the last day of the taking part in the nursing program. It's hard to say goodbye, but I'm also proud of the 2 week journey we set. I would like to express my gratitude for trusting me as your supervisor. Even with the language barrier, I didn't stop us from getting the project done together. I really appreciate how quickly the whole of you adaptation. There is definitely a special bond between students and supervisor that makes our communication so much easier. You are all amazing students with great ideas and is firstly shown during the activity we had on the last day at PSTW Julia of Nursing and Panti Kasih Karunia in Bogor. The elderly people there, Oma Opa, we were so grateful for your time and that you sat with them. They even said, thank you so much for your attention and help toward us. They were said, when you had to say goodbye, I hope the 2 week experience was meaningful for all of you. I also want to apologize if anything didn't go as smoothly and perfectly. The time for guidance was limited because of my responsibility as teacher, and I hope you can understand. Thank you once again to all of you. I wish you the best of luck in your studies. Safe travel, and I hope you can take all the good things from University Western Indonesia. One day, I will visit to ASEAN and we will live every person. Yeah. My impression that the four of you are the best students. Resigning, just musician, and learning. You can work together on the compactly. You can work and complete the final report. Assessment of home nursing activity where I say congratulations to the students. We have completed a home visit internship. Thank you so much.
Much. There's Anita for the thank you speech. Next, we will have a official merchandisation coming from Universitas Kristen Indonesia to Deakin University students. That's why I would like to invite Yasmin to come forward first. And also the Palestine of Faculty of Vocational Studies, sa campus ng Vancouver to give the official merchandise from Cookie to Jasmine from the students. One, two, three. Okay, one, two, three. Also, I would like to invite Krishani to come forward, and also Nurse Erica to come forward to give the official message from Cookie to Krishani. Okay, one, two, three. Okay, one, two, three. Next, I would like also to invite Chanel to come forward. And also, the head of spectrum management, Caroline, come forward to give the. One, two, three. Okay, one, two, three. I would like to invite Melanie forward, and also the director of international marketing, Ms. Benedicta, to take the additional. One, two, three. One, two, three. I would like to invite all the officials forward for the presentation, also the students forward. And also the get our guest. And for international interviews, you may need that representing the children. We're taking the conversation.
Oh, welcome to my
Okay. Everyone, smile. One, two, three. Once again, one, two, three. Cookie side.
Okay.
One, two, three. Okay. Okay, once again, Jack. One, two, three. Cookie side. One, two, three. All right. Okay, thank you everyone. Also, I would like to invite the representative from International Internship maybe to come forward. Give a token of appreciation to Vicky. Also, would like to invite Erica to come forward to receive the token of appreciation from International Internship to Vicky. Okay, please smile. One, two, three. All right, please stay in place. I would like to also invite the officials from Vicky to come forward for taking this conversation. Please. Also, from international relationship to come to also in the. Okay, official camera first. 1, 2, 3. Okay, once again, 1, 2, 3. Faster, Jeff. 1, 2, 3. Okay, 1, 2, 3. Okay, thank you very much. I will also take the time from international internship to give the official merchandise from international internship to the students. I will also please add the student account program to receive the international official merchandise from international internship to Deakin University students. And as well as the weddings at Asia and Nanda is our program. We did the official merchandise from international internship to university. Everyone staying late for taking the presentation. 1, 2, 3. Once again, 1, 2, 3. Thank you very much. All right, everyone. Now we come to the main agenda of this event, which is we will hear the final presentation coming from the students from the University of Australia. There will be followed by the thank you speech, also from the students of the University. That's why I would like to invite 4 students from the University of Australia to come forward and share your experiences and thoughts related to your experience with the business program. So, good morning, everyone. My name is it's an honor to us to present our internship at nursing home in Payung and Kasih Karunia Nursing Home Bogor. So before we start, we want to introduce ourselves. My name is Fernanda Novidamonis, and usually everyone call me Nanda, and I'm a third-year student in Universitas Kristen Indonesia.
Hi, my name is Jasmine. I'm always finishing my master's at Caltech. Hi, my name is Chanel. I'm a third year nursing at the Caltech University. Nama saya Lani. This is my third year of Bachelor of Psychology.
Hi everyone, I'm Krishani. I'm also in my Master of Public Health.
Hello everyone, my name is Kezia. You can call me Kezia. I'm also a student in University Kristen Indonesia and nursing.
So this is a presentation about our internship. So the objectives of our internship, find out about depression of elderly people in nursing homes, both private and public, in Bogor and South Dakota. So depression in elderly people is a global public health issue. It affects the elderly people because they have issues with social isolation and becoming more frail and less physically active. So the objectives of our internship were to identify the key contributors of depression in the elderly people in both nursing homes and provide recommendations and interventions to improve mental health and well-being in both nursing homes to make like sustained change.
We use qualitative different methods of collecting data. So mainly we use that GDS to measure the distribution among elderly. So we have 6 of us and then 2 speaks the Bahasa Indonesia. So we divided into groups on the interview days over the around 40 residents from each house. And then we collected the data and we analyzed, and then you can see the findings in another slide.
So apologies for some of the distortion, I think, for the photos. The first nursing home we went to was a government funded nursing home. This is slightly different, you can change this. Slightly different to the second one we went to in the fact that it lacked a lot of resources that were provided in the private nursing home. So a lot of the elderly people who lived in this nursing home came from disadvantaged backgrounds and that might be homelessness. Because of that, they had low levels of health knowledge, financial knowledge and literacy. So that was a bit of a challenge for us in terms of health. But the public nursing home provided meals, it provided rooms, beds, accommodation. So in that way, this actually really was something that we don't even have in Australia, is that they didn't have to pay to be here. So that was amazing to see. So this is the second nursing home we went to, Taxi Catalina, in Bogor. This was very different from the first one because it was privately funded, so they paid to stay there. And it was a Christian nursing home, so that was a big focus on their spirituality. Yeah, so it was super weird to see the difference between this one and the first one. There was a lot less people, so we felt like we could chat more with like almost everyone at the nursing home. And the staff and everything was really lovely. They gave us lunch one day, which was really yum. Yeah, it was really cool to see, and we really enjoyed our time at this nursing home.
As you can see on the table, we just compared public and private nursing home, and then we found that in the public nursing home there are like 70 people with no depression, and compared to private one, there are 22 people with no depression. And then in the public nursing home, there are people with mild depression and 6 people with moderate depression. And there are 9 people with severe depression. So they basically sort of like, just don't want to do many activities and then like to stay in their place and then And with the private one, we found that like there are 5 people with mild depression and then moderate depression there's none and severe depression there's none. So the interesting thing is in the private nursing home they're quite satisfied with their life and then what they're getting. So just to it's the big sort of difference to see probably to the private.
So after going in and doing all our interviews with the residents, we went in after and did our interventions with them. So at the first nursing home, we decided to focus on art therapy. There was a few people that said they really liked drawing and things, so we came in, we did some drawing with them, which was super cool. We'll see some pictures later on. They all seem to really enjoy it, and we're hoping that in future they'll be able to do it again. We donated the supplies to them. In the second nursing home, we also did some art therapy, and then we also decided to bring some card games and board games because the residents said they really enjoyed that. We had a ball throwing game as well, which was really fun. And again, everyone really loved it. All the residents had a really good time, and it was so nice to see
their smiling faces, so the interventions were really great.
So we had some recommendations for the nursing home, for both nursing homes to implement. We found that there was a lack of social activities. A lot of the residents felt like isolated. They didn't really sort of talk to each other, even though they're living in the same space. So we recommended to increase the social activities so they can have a place where they can talk together and engage with each other. And we also found that a lot of the residents, just like they sit in there, they're not encouraged to participate. So, for the staff to actively participate and help mobilize the residents to the activities that they're providing, so more enjoy it and be a part of what they're providing. We also recommended to develop an activity calendar with different activities for the residents, so they have a schedule of things that they would like to do. And having a designated space for these interventions to happen, so the residents have a communal space where they can enjoy talking to each other. And then we also recommended as well to introduce some like slow paced exercise for the residents so they can get mobilized and move around without causing too much strain on their bodies.
So this, sorry. So this was more, some of this stuff was more focused towards the private nursing home, and there's a lot more to do with policies and procedures. So in the private nursing home, there was not a lot of recommendations from residents on things that they wanted to improve. So what we thought that they could do instead is have more individualized care, because that was something that was possible at the private nursing home. They had, some of the patients had one-on-one care if they were quite sick. So that was something that we recommended, was to make it more formalised in a plan. We thought maybe a resident of the day program, so that's when you celebrate 1 or 2 residents a day for something special. Review policies and procedures to make sure that they're up to date, up to standard with best practice. Having position description for staff, this was something as well for the public nursing home. So we found that the staff, as well as some of the students there was a lot of nursing student placements that were done at the public nursing home, for instance, didn't have like a thorough position description, which would make the activities and the day-to-day care a lot more efficient if people felt confident in what they were doing and they didn't have to constantly seek reassurance. So that was something we noticed as well, and that included the training for staff, including manual handling around dementia. There was a lot of dementia public nursing home, as well as schizophrenia and other diseases. And a palliative care approach as well for both nursing homes, but particularly the private one because they have the resources for that. And having monthly meetings to discuss with the residents, care and other services. So that was something the public nursing home did not do any of. And that was something that we identified as maybe a co-design approach could be established. So the staff can talk to the residents and ask them what they need and ask them what services are missing, like what gaps are not being met, like what needs do they need filling. Yeah, so that was something very easy that they could do to fix it. And then as well with the private one, that was something that they'd been doing casually, checking in, seeing how the resident were feeling, but maybe formalising that a little bit more so it's more yeah, in a policy approach.
Yeah, this one can see is the happy moments in the public nursing and public nursing home, and this is the exact we Antrapi, and then we go with another student nursing, and then we have discussed about the Antrapi, and we hope after this Antrapi in the public nursing home, every student in nursing home can continue the activity. Yes. And next. Yeah, this is the different nursing home. This is the private nursing home. Yeah, you can see this is very different. Like we can see the Oma and Opa. You can see the condition of Oma and Opa. They do the art the same therapy like art therapy, but with the music therapy. And then yeah, this is the picture. Us enjoy the moment in the private nursing home. That's another picture. This is the picture same, but this is the private nursing home. This is the other private, but this is the public nursing home. Yeah, you can see different condition like the function room is the yeah very crowded, and then different to the private nursing home is like very clean, and then, yeah, all my life I'm very happy in the private nursing home.
Okay. These are some of the challenges we face during our internship. I would like to say everyone tried their best and we had the best of everything, what they could provide. So we're really grateful for those support from Huerita and from the girls and from UK University and International Internship Team.
This is the picture we do the weekend trip from International Internship. Thank you for the Nanda come to Bandung. This is the special moment.
I'd just like to clarify as well, this is not part of our research project, this is our fun. So, yes, this is our more casual side of our internship. Yeah.
Yeah. Yeah, it's just like yeah, we can sit to Bandung, and then we in the night we can coffee visit the cafe, the Zola cafe, and then yeah, especially international to invite us to embassy, Australia embassy, and then yeah, this is in Bandung.
We just wanted to put this slide in to say our appreciation to Tessa and Nanda. We really we had such a great time with them. They put in so much hard work and effort for us, translating, helping us, teaching us our Bahasa. Yeah, no, they did such a good job and worked so hard. So thank you guys. Yeah.
And we also wanted to just say as well, a final thank you to everyone who was part of our journey and supported us on our journey. Through this internship, you know, it's hard coming to a different country and trying to fit in and get up to speed. But it was really wonderful and we really appreciate it personally and helpful confidence on our journey. So we really appreciate that and we'd love to thank you and we're going to miss we're going to miss you. Yeah, it's all from us, yeah.
Exactly.
Thank you. We did quick things because we are presentation. Now maybe I would like to hear some comments, questions, or feedback coming from the board. Maybe from the students from nursing study program. Is there any comments or inputs regarding the presentation? Please, we're not scared. And recaps from the students, from the inside, and also the international internship. You may give your feedbacks and comments and thinking words presentation.
I just have a question for the team about the research. And we go back to the slide, the findings, and the depression rate. Yes, so I can see here the number of Oma with depression is quite big, right? Just curious, are they doing anything about this? That's the first question. Second question, are they grouping the Oma like in the group based on the depression level or just randomly, and what do you think about it? Like, should it be done differently? Should people with moderate depression stay together or?
They just get it randomly, but we find it with the public nursing home because around 40 35 to 40 people staying in one big hall, and then it's not going to help for with that because they don't have the personal space and things like that, basic resources. But it's not like in a way because they just funding, they're staying there for free. And then, there's so much they could provide, but like, we, like, that's what we want to do the, whatever the art therapy and the activities we started, we want them to, continue, like to make it sustainable. So I hope they allocate the resources and whatever they need. If there's anything, yes.
Yeah, so the nursing student, the residents were based on needs care, so they had a high needs, like it, and then kind of, they were based on needs. As well, and that's why something that we identified, staff training capacity and the student nurses, because they're under-resourced and, there's not that many, like I haven't experienced that many health places that have such like a task force at hand that they could use that they don't. And so I don't think that they were doing anything about it. And yeah, so it's a bit more like there needs to be some planning around the plays to ensure that everyone's kind of on the same page and working towards the same goal, because we need to see, it wasn't, but he was saying that as well, it's a free place and there's other things to address as well. So like they were getting medication and, their physical needs were more of a priority.
With the instruction, I guess, with the guidance and then have a proper procedure in place, I think because they have all the students helping with enough staff, they need that allocation and designation of that duties, things like that.
Yeah. Because there was roughly 40 students there every day. So it's quite a big group that they could be using better.
One last question there. The private nursing house, so the residents there, do they still have family or they're there?
They have families, but they can't provide the key funding one, so they provide the financial support. Yeah, it's much better compared to private one. They got one specific room and the bathroom, and then some of the residents, they got 1-on-1 So it's pretty good, but like it's just we found that they could improve on things.
Do their family visit, right?
Yeah.
I think there was a lot more residents that said their families visited as the public, where a lot of them said that they'd been used as in their families or,
They overseas.
yeah.
Someone,
Louise, is there any questions coming from the students? Or input, anything? You can just deliver your thoughts, deliver your comments to the presentation. Yes, please.
Hello, my name is Nandita from Nurses Progress. So I would like to ask you guys, what is your biggest challenges and how you guys can situation maybe the biggest challenge from this program.
As in personally or through the project?
I think the biggest challenge for me, and probably a lot of us, was the language barrier. Yeah, it was hard to communicate sometimes, but the way we got through that was with these guys, helping us translate it. Yeah, sometimes more complicated terms and things would get lost in translation. But yeah, we would rely on them, use Google Translate, and because everyone is so nice, throughout the program and just in Jakarta in general, everyone is so lovely and understanding. Yeah, it wasn't that big, even though it was a challenge, we were able to overcome it. Yeah.
Yes, you did clear. All right, thank you very much for the answer as well as the questions. Is there anything from the floor? If there is none, we will proceed to our next section.
Yes. Okay, so my friend was want to ask you guys something. He said that while you guys doing the internship and the party, right? Yeah, the party. Oma Opa just like he wants to know that Oma Opa, are they giving you good feedback? So put an attention to you guys or listen to you well, or are they just some of them ignore you or something? Are they give you a good feedback while you were doing internship? Yeah.
There are some Oma Opa give a good feedback to us, and there are some really like when we ask A, they're gonna answer like B, C, and then like that. And overall, they give the good feedback to us.
Most of them they have been for us to be there and then they enjoy with their parents.
We're very happy for like we talk to them like.
Yeah, that's it. Is that your whole question or do you have further?
Yeah, he wants to ask that. You wonder, he's curious. What are while you interact with them, are they have a good feedback or not?
Yeah.
Even while they're doing the activities, we could see they happy with like before they come to the activity, they're just sort of, in a different mood. And then after they're finishing the activity, you could see they're all happy and smiling. And when we throw the ball, even like, and we had a one Opa, yeah? Opa, and he was just a little stiff. And then after we throwing the ball, few times he got his reflexes very well, and then it's very happy. And I think it's just a nice thing to see. They're moving around. Yeah, we were really happy to see them smiling. That's why we want them to continue those programs. Yeah.
Okay, thank you very much for the question as well as the students. Just please stay in place because our next section is we will hear the 90 speech coming from the university students as well as the judges. Once again, please give a big round of applause for this. Yes, now we will hear the 90 speech coming from the university students as well as the student judges.
Opinion they're gonna say first. So we would like to say thank you so much for international internship and also Lucky for this opportunity and we'll be able to making friends with our house friends, their Tulani, Channel, Jazz, and Chris. I'm so happy and we can share our idea, our culture, and then we hang out together. And also, got a new experience, amazing experience with you guys. We're gonna say apologize if people made mistake or anything. So thank you so much for
Everything again. No, just me and Anda take care of it, but you take care of me and Anda like this.
We can.
thank you for hosting us. We've learned a lot through this internship. And for us, I think it's been more than just an internship. We've made lifelong friends with Amanda and Kezia. They've been really helpful. I think they've been more than just our buddies, have been our friends. We also have to thank the international internships as well for the opportunity. We've all enjoyed our time here and we'll definitely be back in Indonesia soon. Thank you to Rita as well for being our supervisor. We really enjoyed communicating with you and learning from you as well.
Thank you very much.
Right, everyone, perhaps before we vote that today, I would like to invite all participants to partake in the conversation. Maybe we can partake in the conversation here and the students may be here. So it's from here for the official and also the students and students is stand up.
Tidak apa-apa.
Again, 1, 2, 3. Good. Susan. 1, 2, 3. 1, 2, 3. Okay. All right. Everyone, please sit here. We're about to close our event. All right, everyone, we are now at the end of our event. Thank you very much for attending our event, the final presentation of the University Deakin Internship Program. This marks the end of our event. Thank you so much to the officials as well as our distinguished guests from International Internship, the University students, and also the students. With all that, I am Queen. Thank you very well and have a good day. Thank you, everyone. Bapak dari International Internship dan juga official kami sudah dibawa untuk mengikuti evaluasi for belakang itu nanti bisa di scan dan pakai. Terima kasih.
Maybe today, maybe that's not a big word.
Is that like we were seeing that
And that's, I'm doing chocolate and one and doing one. I think it's good with that whole like. Activity. Yeah, well, they are only up to.
there's a how related to the and that is so benefit from and one.
Well, we see that in the. You're not really. Yeah, it's like, it's not very like. So they would feel like, yes. Definitely better. Yeah. I think I've actually. But like. They would do it okay. It's a class, but it's like. They have one day. We often we have like. Meetings and policies, also stuff like. They don't actually have. And that's what they call and then again. They would provide. There's like a lot of the debate.